Please listen carefully for this message. Tant pis, côté message là, moi quitter avec Daniel Jean Louis. Daniel.
Thank you. Very nice of you. Thank you. Hi, everybody. Did you have a great lunch? That means you're going to fall asleep. Today I have good news and bad news. Somebody said something, I didn't quite understand it. Could start with good news. Why you guys want the good news first and not the bad news? You know, they could both equally be important. The good news is the healthcare industry in Haiti can be restored. It is not completely lost. It's very challenging, but it can be restored. And I'm saying this for two main reasons. The first reason it can be restored is because it is necessary. I don't know a country in the world that make it without a good healthcare system. From individuals, you need it to live, normal modern care in modern world. When you're sick, curative healthcare and preventive healthcare to get all your shots and vaccine and make sure you're in good health. So, healthcare is not something you can, it's not optional. Healthcare is not something you can choose. Healthcare is something you have to choose and you have to embrace. And talking about this referred to two different notions. The notion of training, the training of nurses and doctors and health professionals from handling the patients to the transportation and to the follow-up of the patients. And it's important that people in this country have good training so they can handle all of the different aspects of the healthcare industry. Not just training, but also standard. In a lot of developing countries, all developing countries, healthcare don't just exist. They exist according to predefined standard in the training, the handling, the certification of the doctors, the nurses. Everybody is evaluated, work according to a certain standard. Is that possible in Haiti? Yes. Not only it is possible in Haiti, but it is mandatory that we get there. Making that a choice is a mistake because this is the standard way all healthcare industry work all over the world today. The second reason is why this is good news. It's because it is an absolute opportunity for job creation. Listen to this. Think of healthcare as a chain. The chain that has different pieces from hospitals. The healthcare is not just hospitals, but there's a lot of part of it that has to do with hospitals. The building, to build a hospital, how many millions of dollars goes into the building, the plumbing, the electricity, the pumps, the sewing systems, the engineering, architecture, parking. Think of all the hospital equipments, MRI, X-ray machines, hospital beds. All of this are manufactured, transported, installed, and make sure they run properly. Each and every step of the way is an opportunity for businesses to start, grow, and create an employment. That's why it is another absolute reason why healthcare is not just a choice. It is mandatory. Well, there's also the bad news. The bad news is healthcare is very expensive. it needs a lot of resources for this chain of this machine to work and all the players that are part of it to become interlocked into each other and work with each other in collaboration within each other to make that machine work in an effective way. Where does Haiti is going to get this resource? That's a big question. In a developed world, such as Canada or the United States, or even countries today that are coming up like South Korea, or even Vietnam, but the most developed countries that are capitalist, people pay premiums to the insurance companies. It is from individual to business and from business to care. From individual to insurance companies and insurance companies to provide health care. That's a very simple choice, you would think. So when somebody's sick, if you have health care insurance, if you're sick, you go get the care that you need, and the health care is paid for by the contribution that you have into that insurance company. Very basic standard, same as a health subscription you have with your car insurance, so it works that you pay for it ahead of time, so when you're sick, you get the care that you need. In that way, the health continues to be provided and paid for, and then continue to roll into the future. Well, some developed countries, for instance, you work, you have a job, you pay high taxes. For instance, Canada I just talked about. You pay high taxes, and those taxes go to the government, and the government in return provide health care to you. See what that involves there? In both cases, it involves the individual making a contribution into either a private company or to the government. The work starts there. That's why it's a bad news. In Haiti, that starting point, which we call in economy the disposable income, is almost missing. That piece, the contribution that the individual either paid to the insurance company or paid to the government, is almost missing. So then, who pays for the health care? If individuals don't have all the incomes they need to pay for it, if the government cannot collect all the necessary taxes, if the insurance companies don't receive their premiums to provide that care, how in the world can people have access to health care? That's $1 million question. And the answers to that, we don't. It's just that simple. If you look what has happened between what is absolute necessary, mandatory, to the inability to provide it, there's a huge catastrophic events that have occurred in the meantime. Remember cholera? Cholera is the cause of the necessity of health care and the inability to wash your hands properly. Remember disposable income? Remember what we call the purchasing power that people have to be able to purchase the necessary hygiene elements to prevent them from getting cholera, for instance. Over 10,000 people have died from cholera. You know who died from cholera today in the whole world? No one, except to those who are poor. Cholera is the disease of the poor. Period. And it is the disease of the poor. The poor of Haiti are dying of cholera today, not because they are poor. Poverty is a consequence of lack of job. This is the absolute important point of this discussion. Not only healthcare is a necessity, not only healthcare is important, it is mandatory. Not only that, healthcare is an important source for job creation. Think of it this way. All the companies that are involved within the healthcare industry, starting from hospitals to transportation, and I'm happy to, right now I can say my company's Bridge Capital is very close to investing a significant amount of money into Hero ambulance services. I don't know if Stacy's there. And we're making very good stride, and we're hoping in the next 5 years that we'll be able to make other kinds of investment in different sound businesses that can serve into that industry. So basically, from hospital to transportation to handling to equipment manufacturing to hospital supplies, there's opportunity to provide that disposable income we are talking about for people to be able to afford to pay the premium, the prices for the healthcare services they need. Not only curative healthcare, but also preventive healthcare so make sure that people can be healthy to provide for jobs and be a good part of the country. Think of it this way. People live 55 years today. Why? In Haiti. Think of the high rates of infant mortality. Why? Why so many babies die so early? Why then adults die? So I'm 39 years old, if I can think correctly, 55 minus 39. On average, I can tell you how much time I have to live. Hopefully I make it past that. But this is serious. Very recently, a senator has a stroke, has to be medevaced to the US. A president had a stroke, didn't make it to the hospital, didn't make it to the US. A president got a minor problem, he had to fly to the US to get health care. The head of a private company is sick, didn't make it to the hospital, didn't make it to the plane, didn't make it to the US. The small amount of people with money, they count on going to the US if they're sick to get health care. How insane is that? You think if you're sick, you're gonna make it to the United States or to the border? Do you know how Albert Einstein said, insanity is repeating the same thing over and over and over, expect the same results? Well, that's what we're doing now, isn't it? Why don't people have disposable income to afford health care? I talk about 3 different reasons: political instability, corruption, and foreign aid. Unfortunately, we have all 3 here, and throughout history, the existence of Haiti, it seems like we are married to those factors. The unstable Haiti, the ugly Haiti, the trash Haiti, the underemployed Haiti, the unemployed Haiti, never the job Haiti. The complicated complex problem of healthcare has the primary, basic, fundamental solution, and it's the most easiest word to pronounce in the world. It has 3 letters, J-O-B, jobs. Because with your job, you get an income. With your income, you can either pay a private company, or depending on the system set up, or you pay to the government, and then in return, you benefit the care, curative care and preventive care that you need. Those are not the only reason why this is bad news. It's bad news also because healthcare is very linked to basic infrastructure. How would you transport a patient from Jeremy to Port-au-Prince that suffered a stroke? How? Would you get somebody from Anse Rouge, from Port-de-Paix to Port-au-Prince, or to Saint-Marc, or to Gonaïves, without decent roads? How would you build a hospital in Les Irois if there's no electricity there? I wonder how the X-ray machine was going to work. To have health care, effective health care, is very linked to jobs, to basic infrastructure, such as road, electricity, transportation system. It's all linked with each other. And the basis of lack of those start with the lack of employment, start with the lack of economic opportunity, start with a lack of investment, start with a lack of decency, for cry out loud. If we love our countrymen, if we love our people, if we see ourselves when we look at them, we don't see them as ugly, we will provide the system, the setup, the incentive, whatever necessary for economic activities to start, for people to start living with dignity so they can afford themselves their healthcare system. Do we need another senator who's evacuated to the US? Do you need another 10,000 dead babies? Then where is the investment coming from? What is going to enable the healthcare system to happen without the infrastructure? Impossible. It hasn't been done. Which leaves us one answer. The healthcare is interrelated to all other industries in politics and economics of the country. You cannot remove healthcare from economic development. The attempt to that would be simply ineffective and fail. You cannot remove healthcare from political decisions, good, sound legislative decisions that are fair, productive, just, and working. The simple attempt to solve healthcare, to isolate healthcare by itself, and piece by piece solve its problem, thinking that it's completely separated from the politics, from the economics, from the jobs, from the infrastructure, is ill thinking. And it will fail because it is closely linked. Just like the body, the human system has different systems into it. There's the respiratory system. Dr. Gardy knows all that stuff more than I do. The urinating system, the heart system. It's a bunch of small little systems that comes together in collaboration for the body to work. If one of those systems shut down, if you can pee, or you can eat, or you can breathe, you will die. It's the same thing for the healthcare. It is one system that is part in collaboration with many other systems. When they work together, they provide an effective service for people in need. That's it. This is it. This is the tough part where we get, then what is the solution? First of all, we need better leadership. Tired of all good old politicians burning through money, lying to people. Craziness doesn't work. We need better leaders. Do you know that last year's budget, the healthcare system had 50% less resources than the legislators? The parliaments, the deputies and the senators, they had more money in that budget allocated to them than the entire healthcare industry in Haiti. That is supposed to pay for doctors, nurses, supposed to pay for ambulance services, electricity, hospital overheads, build new hospital, take care of all hospitals. Can somebody think of what could be another reason why senators and deputies would need more money than the entire healthcare of Haiti? Maybe we need a little bit more psychiatrists? Is that what it's called? Try to make sense of that. The basic love and compassion, the basic dignity of human, in thinking that for your own self-service, you need more money than the entire healthcare industry, is preposterous, is mean, and is criminal. Not only we need better leaders, but we also need better collaboration from the NGO community, the government, and the private sector. The NGOs have the most amount of money that I've ever seen in this country. The total budget of the government is now $2 billion. Do you know how much the total amount of money the NGO community has? How are you accountable for all this money? It's easy to point fingers. It's easy to get mad, to get deceived, to tear. But it is hard to come together and think with the other players of how we can find innovative solutions to bring the incentive for the right amount of investment to come into the country. Work with the government so they can build the supporting infrastructure to enable the healthcare industry to work so we can provide decent care to our countrymen, to our brothers, to our sisters. Until we start thinking that way, the 1% is always going to try to go to the US for care. The middle class is going to be squeezed between mediocre health and the lower class, which is the most amount of people in Haiti, are simply going to die. Is it normal we have so much trash on the streets? Let's see what healthcare problem does trash can cause. It will bring back maybe diphtheria. I don't know if there's a causal relationship between those two, but having trash causes a lot of serious health hazard. until we start thinking collaboration, innovative solution, think of healthcare as part of all the other system that needs to come together to provide healthcare system, economic prosperity, jobs for the country, until you see the exact length, you see clarity between the relationship between those two aspects, I'll tell you, we will continue to feel like we have in so many decades of waste of energy, resources. It is then we're going to start seeing some sort of improvement for the betterment of the Haitian people. Thank you. Thank you. Thank you. Thank you.